Hello, everyone. Thank you for joining today's webinar, Youth at the Center, the Design and Delivery of Mental Health Services with and for Young People. It's 3 o'clock on the nose right now, so we'll just get started. I'd like to begin by acknowledging that CMHA BC Division's office is located on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. I would also like to quickly acknowledge that the slide you see in front of you was provided by two of our previous webinar speakers, Jenny Morgan and Vanessa Bursick. Now, before we launch into the content of today's webinar, I would like to point out a few features of the technology we're using and quickly run through the agenda. First of all, there are two options for sound. You can listen with your computer's audio or dial in by telephone. We have an international audience today, so you'll find two toll numbers, one for Canada and another for Australia. Please ensure if you choose the telephone option that you dial into the number for your location. You also have the option to switch from computer audio to telephone or vice versa at any point during the broadcast. Second, we will be recording today's session and posting the video online at beforestagefore.ca alongside a PDF copy of the PowerPoint slides. You also have the option to download the slides at any point during the broadcast or afterwards before closing the window. The file is located in the handout section of the panel to your right. Third, after the presentations, there will be an opportunity for audience members to ask questions. Please type your questions into the questions section of your panel to the right. You can do so at any point as they occur to you. The sooner, the better. I'll collect questions throughout the duration of the webinar and read them out to the presenters in the order I receive them during the Q&A segment near the end. If you'd like to address your question to any one speaker in particular, please make a note of this in your submission. We'll try to get to as many of your questions as possible before the end of the webinar. Okay, a little bit about the content of today's webinar and our speakers. We are joined today by Carrie Buhaj, Director of Service Delivery, and Jess English, Online Community Coordinator from Reachout Australia, and Andrea Vukabrat, Peer Support Coordinator from Foundry BC. In their presentations, each will discuss how youth are involved in designing, delivering, and evaluating their mental health services and programs for young people. Both Reachout Australia and Foundry BC demonstrate the importance and effectiveness of intervening early in illness and early in life for mental health and substance use problems. The signs and symptoms often first occur in mid to late adolescence, have their peak of severity during this period, and here in BC account for 55% of the disease burden in young people aged 15 to 24 years old. Over the past 14 years, the representative of children and youth, a nonpartisan independent officer of the legislature that supports BC's young people and families, have issued multiple reports and concrete recommendations to create a clear and comprehensive system of mental health and substance use services. This includes prevention services, support for families, a variety of residential and community services, and appropriate emergency and acute care. Their latest report on youth substance use foregrounds the importance of youth engagement in this process, calling on the new Ministry of Mental Health and Addictions to embed the knowledge and expertise of youth in the development and implementation of their forthcoming mental health and addiction strategy for children and young people. Multiple frontline organizations, in concert with the representatives' efforts, have fomented a growing recognition in our province of the need to meaningfully involve youth in implementing policies, programming, and practices that are more attractive and beneficial to them. Reachout Australia and Foundry BC are two incredible examples of organizations who have been leading this groundswell change, both here in BC and abroad. I'm incredibly pleased to introduce our speakers. As a leader in health system reform, Dr. Carrie Buhaja has over 15 years' experience modernizing services to meet the changing needs of community. In her role as a Director of Service Delivery at Reachout Australia, she oversees their digital mental health programs for young people, parents, and schools, and strives for the meaningful involvement of service users in the design and delivery of programs and systems. Carrie's colleague, Jess English, has been a lived experience advocate in the perinatal, child and youth mental health and peer support workforce spaces in Australia for the last 8 years. While relatively new to her role of Online Community Coordinator at Reachout Australia, joining the organization in June 2018, Jessica brings an extensive background in youth peer support from public health inpatient settings to peer education with Recovery College to policy and systemic advocacy. Last, but certainly not least, as a peer support coordinator at Foundry BC, Andrea Vukabrat is currently working to develop an evidence-based peer support curriculum alongside others who have experienced mental health or substance use challenges. As a peer, volunteer, and advocate, Andrea has seen firsthand the positive impact that peer involvement can have, not only on those accessing services, but also for those delivering them. Okay, without further ado, I'll hand it over to our first presenters. Carrie and Jess, take it away.
Thank you so much. I hope everybody can hear me okay, and the technology is working all the way from Australia. I'm Carrie Buhaja, as Amelia just introduced, and I'll be shortly joined by Jess, who's one of our team members here. And I'll start by giving an overview of the work that we're doing at Reachout. Many of you probably aren't so familiar with our organisation. And then Jess will talk in particular about a case study on how we deliver our online peer support program to young people. But first of all, thank you so much for the opportunity to come and present at this webinar today and to share some of our experiences of how we approach participatory design with young people and peer support in the online environment. So for those who don't know Reachout, we first launched about 20 years ago now. It was way back in 1998, and it was a time when we had dial-up modem, and you could you could hear that ringing when you dialed it up. And having internet within households wasn't ubiquitous, and I think a lot of people sort of wondered, what on earth were we doing? And since that time, 20 years later, our smartphones are more like an umbilical cord for us now, and we quite literally have access to information and to support at our fingertips and in our pockets, and that includes a whole range of different mental health supports as well. The other thing that we were known for when we launched back in 1998 was that from the very beginning, we very deeply and meaningfully involved young people in the design and delivery of all the programs that we offer, really making sure that we could harness their ideas and insights and the expertise that they bring from their own lived experience. So if we can just move on quickly to the next slide, I'll just give a little bit of an overview about the programs that Reachout offers. So our flagship program, our services are down the left-hand side of the slide. Our flagship program for young people is a prevention and early intervention program for young people aged 14 to 25 years. We offer information and resources from anything from everyday issues, things like study and sleep, through to tough times. We also offer a range of apps and tools that are both professionally and peer-reviewed so that young people can use them to work on their own mental health and well-being. And we have an online peer support community, and that's where young people can have conversations with each other about the things that are on their mind in a safe and supportive environment. In addition, we also have a program for parents to help them build the confidence and skills in how they can connect and communicate with their teenage children. And we have a program for schools so that we can help secondary school educators to build a safe and supportive learning environment, while at the same time teaching students about the skills associated with well-being. And across all of that, we have a number of supporting functions. So we use our communications, in particular social media, when we're talking about young people, to have engaging conversations, usually in a more lighthearted way, using approaches linked to health promotion, so that we can really engage young people in having conversations about their mental health and well-being. Our product development is really about what new and emerging technologies young people are using, and how we can then build our products and services in a way that enables it to really easily interface with the way they live their lives. And our research team is really active in engaging with young people to better understand their needs and preferences. And across every single part, both the programs and the supporting functions, we have a really deep approach to how we do youth involvement. So if we move on to the next slide, I'll talk a little bit more about that. And this is probably a whole day workshop if I had more time. But predominantly the methodologies that we use to involve young people sit under the umbrella of participatory design. And it's usually a very creative approach. It's a lot of fun for both the participants as well as for the researchers that are involved. And it enables young people to be really meaningfully involved in designing and delivering all aspects of the service. And that's right throughout the design and delivery process. So right from working with young people to identify the problem space and define the goals that they want to achieve within their lives, to helping us build the concepts around that and how the products would interact in their lives, and then moving through to co-creating the solution. And we also have processes for continuous and iterative feedback on that as well. So we do make sure that it's an iterative process, and we involve young people from the beginning right through to the end of that process, and enabling us to work with them to deliver the services as well. And one of the key tools that we use is the development of what we call personas or archetypes. And these are, I guess, fictional characters that reflect our target audience. And when we use these in our workshops and our activities with young people, it helps them to step outside of their own experience, so that they're often much more open to kind of sharing and sharing ideas and insights about how they want services to be developed and delivered. So a few examples of how we work with young people to involve them within our service design is we have a content squad, and that's a group of young people that actively review all our articles and content that goes up on our website. We have a youth advisory board, and they're a group of young people that more actively work to give feedback on how they want the programs delivered. As I mentioned before, we have an ongoing program for UX testing, which can happen both in a face-to-face environment as well as through online mechanisms. And we have a youth moderator program as well. And that's a group of young people that are actively involved in the moderation of our peer support community and really are the eyes and ears of our community and help to keep the members of that community safe and supported online. And I'll hand over to Jess shortly, who's going to talk a little bit more about that program and how that operates. But just before I do that, if we move on to the next slide quickly, I just wanted to talk a little bit about where we see peer support as fitting within the broader mental health system. And a few years ago, Reachout developed a report. It was called Crossroads, and it's available on our website. There's a link at the bottom of the slide there. And we produced this report in partnership with EY, or Ernst & Young Consulting. And it really explored the future of Australia's mental health system. And it basically modelled the projected demand on the mental health system over the next 10 years and had a look at what resourcing would need to be applied as a result of that. And without getting into too much detail of the modelling, which is quite complex, and for those that do like the detail, you can access that from our website. The report concluded that if we are going to be able to respond to the increasing demand on mental health services over the next decade, we really need to be looking at new and innovative models of care, and in particular around the lower tiers of the mental health system, where the interventions are kind of lower intensity, they're more scalable, and they can be accessed by a broad number of people. And of course, that's not to say that the higher intensity approaches that you can see within the slide there aren't critical. Of course they are, but on their own they won't necessarily be able to respond to the breadth of demand that we're likely to see in the next decade. So peer support, and one of the thing that we also know from our own research is that for young people who often have a high preference for self-reliance, they're often initially a little bit reluctant to access professional support in the first instance. And we certainly know from our research that our online peer support community can be a great facilitator in terms of breaking down some of those barriers to access the higher intensity support as well. So Reachout, we've recognised that peer support is a really critical part of a youth-centred mental health system, and it provides a really unique and impactful contribution. And of course, when you take that online, it also allows the scalability of an online system and also an anonymous approach, certainly in the model that Jess will talk to you about in a moment. So I'll hand over to Jess now, who'll talk you through the Reachout's peer support program and how we work hand in hand with young people to make that a success.
Hello, so my name is Jess and I run our online peer support communities for youth and for parents. I'm just going to speak a little bit about peer support, our model of peer support, and how we involve young people in our online forums. So peer support we see is between one or two or more people, and it is where there is a shared experience or understanding. When we talk about peer support, we're talking about embodying these principles that you can see here. So we talk about mutuality and empathy, which is having a shared understanding or experience where you've walked the path that someone else has walked. It's around empowerment, so self-determination and supporting people to take steps forward in their recovery. It's about hope, so it's about holding hope when others are really struggling, but also being able to project that hope for other people and help them see a light at the end of the tunnel. It's about reciprocity, where giving and receiving support is something that is mutually held, and regardless of whether you're the person that is providing the support or receiving the support, both people benefit. We talk about equal power, which is where every person is given a voice and that voice is equal. We also talk about respect, and that's about respecting that each of us has an expertise from our own lived experience that is valuable and unique to other people. And I guess what makes it really special is that it is mutual. We see it as a horizontal relationship where both people benefit. Just going to go to the next slide. Thank you. So I'm just going to talk a bit about Reachout's model of peer support. So we have two online peer support communities. We have our youth community and we have a parents community. When we talk about peer within the context of our community, we're talking about a very specific definition. So within the youth context, peer relates to young people aged 14 to 25. And they have a shared experience and quite often are going through similar things at similar times, which is why we feel that peer within that context, it's really important that we do find people within that age group. And for parents, peer is relating to a lived experience of caring for a child aged 12 to 18. When we talk about our model of peer support in the forums, we have quite a unique model in that we provide both formal and informal peer support. So our formal peer support we provide through our moderator program, who are trained peer supporters and share their lived experience in a very intentional way. And we also have informal peer support that happens between members and passively when people read through the posts. If I just go to the next slide, I'm just going to talk a little bit about the user journey and why someone would come to the peer support forums. So a lot of young people and families come with an idea in mind. They might have a question, they might have a topic that is really important to them in their lives, and they come to the forums to hear from other people about their experiences of managing the same experience. So we have a number of ways people will engage. So some people might choose to become a member, which gives them the opportunity to post their question or talk about their story. And we also have some people that will never post online but really benefit from reading other people's experiences. What we find is that someone seeking support can do that actively or passively. So actively is when that person is posting to seek support from other people, asking questions, asking for lived experience, or very passively where they might be looking for a specific question or answer and they're able to read through and feel validated in their experience and take some steps forward using the tips and help from other young people. We also see a lot of young people then use the support that's been role modeled to them to help provide peer support to other young people. And this is what's really incredible about our service, is we see people bounce in and out of supported and supporter roles, and that's a really important component of peer support. Just go across to the next slide. Let's talk a bit about our peer moderator and parent peer supporter programs. So we have a program in place to be able to formally train peer supporters, and they help us with a number of different areas of the forums. In particular, the main component we ask from our peer supporters is to provide peer support. We train them in being able to share their lived experience in a way that can support other young people and parents. We teach them to be able to provide practical, emotional and social support. So this might be from talking about how they managed a situation, to sharing resources that they found really helpful, to encouraging other people to take steps in seeking help. From community moderating perspective, we actually ask our community to help us keep it safe by enforcing the community guidelines within their own capacity. So we encourage our moderators and our peer supporters to be able to help other people be able to create a safe environment and post in a way that maintains the peer support within the community and the confidence of others that are posting. Mentoring and leadership. So we see a lot of our young people and our peer supporters actually mentoring and helping other young people to understand the importance of peer support and how they can support other people with their story. They encourage people to take steps forward in their recovery, try new things and see what works for them. And we also see with community building, we have our moderators and peer supporters that are involved in creating community activities that bring people together around specific topics of interest. In the next slide, I'm just going to talk a little bit about how we manage risk and keep our forum safe. So we have three main ways that we do this. So we have a digital triage, and for our youth forums, we're able to triage every post that comes through, and it flags keywords if there's anything associated with risk or something where that young person might need more support. We also have community guidelines, which set out some expectations around how to use the forums in a really safe way for both our parents and youth communities. And we also maintain anonymity so that no person can be identified by their posts or by their information. We want people to feel safe to ask the questions and talk about the really tough stuff without fearing that they could be identified. Just got one more slide looking at the benefits of what our community has offered. And we've seen a wide range of benefits. These are sort of some of the key ones that come to mind in the research that we have done. We see a lot of young people feeling really isolated, and coming to the forums, they feel that sense of connection and community that they might miss in the outside world. We see an increase in hope, particularly for young people experiencing mental health concerns. It gives them an opportunity to feel validated and hear from the experiences of other people that have gone through that experience and have come through the other side. We see a lot of young people feeling empowered to take steps to improve their well-being, but also including help seeking. So a lot of young people will then let us know that they have gone and taken that step to go and see someone and get professional support. We see a lot of opportunity for new and shared understandings within the community, and the ability for people to contribute their ideas and create a space where many different ideas and ways of approaching an issue can be held in the one conversation. We see an increase in self-esteem and confidence, particularly around managing mental health and well-being. We see an increase in empathy and understanding, including a lot of young people then moving forward to be able to support others in their journeys too. And we also see an increase in resilience and the ability to cope. And this is something that we see role modelled a lot by our peer supporters and our Moderators program. So that sort of gives you a bit of an overview of our service. And we'd really encourage you to have a look at our website if you would like to learn more about peer support and the way that we do that in an online space. Thank you very much.
Thank you very much, Carrie and Jess. Please, if you have questions for either Carrie or Jess, write them in now and I will collect them for the end when we have our Q&A session. But right now, I'd like to turn it over to Andrea from Foundry.
Hello. Thank you very much. I'm just going to start by introducing myself and the people that are in the room with me that you can't currently see. I am the Youth Peer Engagement Coordinator. I've just shifted over into the Peer Support Coordinator role at Foundry Central Office. My role has been around supporting youth engagement as well as peer support centrally and on a local level. And I'll tell you all a bit more about Foundry, but I also wanted to introduce the people that were in the room with me. So there's Rebecca Zappelli, and I don't know if you want to poke your head. Rebecca's my director, believe it or not. And then there's also Stephanie Gillingham, who is she's been leading quite a few things, but specifically the development of peer support at Foundry. And so I feel very happy to have them both here because with the work that I've done, they've been very supportive, both around youth engagement and peer support. So with Foundry, Foundry is a provincial initiative in British Columbia in Canada, and it is an initiative that's focused on bringing centres to communities across the province, centres that are one-stop shops for youth wellness for youth 12 to 24. And so when we say one-stop shop, the idea is that a youth can walk through the door and get whatever services they might need for that day or on an ongoing basis. And we've been around for about 2 years now, so still fairly new, and we're currently open in 7 communities across BC, with 4 more to come in the near future. Next slide, please. So youth engagement at Foundry, we see it as a way to ensure that Foundry and its sites embed youth voice, perspective, and wisdom at all levels, and also to support the local centers in engaging with youth, including things like developing professional capacity building opportunities and infrastructure to support local and initiative-wide engagement. So with my role, it's been really interesting because I've been supporting youth engagement on a central level and bringing in youth and young people to inform what we do centrally, but then also supporting it at the community level. And when it comes to the community level, all of the Foundry centers, when the communities applied to have a center in their city, they applied with some sort of partnership with a group that does youth engagement. And so moving forward, we've really wanted to respect the autonomy and the uniqueness of each community by kind of allowing them to move forward with youth engagement the way that they feel is best, but then also wanting to unite everyone in a way where we can all learn from each other around youth engagement. And so we started something called the Youth and Family Engagement Working Group, which is composed of people who are leading youth engagement at the centers, and has been an opportunity for people to learn from each other and to connect with each other. And I don't want to say create a community of practice, but kind of like that with youth engagement. And so that picture that you see there where it says Yell for Youth Engagement, that was from an event that we had in February, and it was called the Youth Engagement Link Up, and it was where we brought together people who were leading youth engagement at the centers, youth from the centers, and a few service providers to kind of start things off in a good way in terms of figuring out, what does youth engagement mean to everyone? What does it mean to respect autonomy when it comes to youth engagement locally, but then also having certain standards and stuff like that in place to make sure that when it's being done meaningfully. Next slide, please. So youth engagement, it's been something that we've seen from the start as a way to ensure that any services that we create, any supports we develop, anything like that is created with the people that it's for, because then we know that it'll be the most appropriate that way. And so those pictures there are pictures from the branding process. And often, when we talk about the branding process and stuff, it can sound a little bit corporatized and stuff like that. But I think, what's really important to mention is that when we did that, it wasn't because we were like, oh, we want to have a brand that we can market. It was because we wanted to make sure that there was a certain feeling that people got when they heard the name of the center, and there was a certain feeling they got when they walked into the center. And so things like selecting color Pantones and stuff might seem like a different world from wellness and stuff, but it's actually really important for us that there is a commonality with the experience that people have when they enter a center. So when it came to the branding process, many youth were consulted from across the province, as well as a few national youth focus groups, to ask them questions like, what would a good name be for the center? And Foundry was selected. It was interesting because with Foundry, quite a few of the adults and stuff that were asked about Foundry, they were like, oh, well, like a Foundry is a place where like metal is forged and stuff. But there wasn't that association for a lot of young people, and they really appreciated the name Found in it. And they felt like it wasn't, cheesy or corny. They actually felt like it was a kind of an in-between that like cheesy and corniness, but also having that practical aspect to it. And with the colors that were selected, those colors were specifically selected because those are the colors that felt the most comfortable for everyone. And I think something that's really relevant, and I don't know if you guys can see like the little logo in the bottom left there, that green O was actually recommended by a young person who mentioned that they felt like that would be really meaningful for them because that O, it has that holistic sense of wellness, and the circle is a pretty significant piece to that. So there, like from the start, including the branding process, youth engagement has been really on the radar and has been something that's been a priority for us. And so with that quote that you see there, programs should be designed which maximize the opportunity for any youth or family to choose to participate at the highest level of their ability. That's from Roger Hart, and I just want to clarify that it's not just ability, it's also desire. because we want to make sure that when we do youth engagement, we're doing it in a way where the way that people want to engage with us is the way that they are able to. And I think a really important piece of that is that local autonomy piece that I spoke to, because we feel that communities will best know what is needed for their young people, or what is needed for themselves when it comes to youth engagement and youth engagement activities. And next slide, please. So this here is a table that was created from Roger Hart's ladder of child participation, but also with that Roger Hart's ladder was adapted by the Texas Network of Youth Services, which sounds really random, but we found their table on the internet, and we really liked it because it incorporated the governing piece. So we feel that this table speaks to us. It has enough specificity to explain what is needed when it comes to youth engagement, but enough flexibility where communities can kind of see where are they at right now, and where would they like to be, and what will they need to get there. So wanting to communicate to communities that, you know, there are ways to do youth engagement that are not appropriate, and those are the tokenism, decoration, manipulation, and explaining what those are. And then pretty much anything above that is good. And it's not that one is better than the other. It's more just looking at what ways are you doing it, what ways would you like to do it, what resources might you need to do more of that. Next slide, please. So when it comes to youth engagement and family engagement as well, but specifically focusing on youth engagement for this, it's been really important to us to figure out ways to communicate to centers what we would like to see, but to also have that flexibility for them to do youth engagement in a way that their community wants it to be done. So we figured that if we created these principles, then we could communicate, you know, these are the things that we believe underlie meaningful youth engagement. And so just starting with respect, I think that was kind of the first principle that we settled on, because with respect, like the dictionary definition is admiring someone deeply for their abilities, qualities, or achievements. And I think the idea of respect is to show someone that you care about them, and that you admire the work that they do, and you admire their presence. And that can be communicated in so many ways, but I think really underlying respect is that piece around are the three other things, and that's kind of why there's those circular arrows, because they all play into each other. So with reciprocity, that supports respect, because the idea is we're not just taking things from people. We're not just having, you know, consultations with youth where we get their thoughts and then we just walk away and never tell them what happened to their information. It's the idea of if you are getting something from someone, you're also giving something back. And again, leaving it up to communities to interpret what reciprocity looks like for them. So for some centers, it might look like paying youth for their time, but for other centers, they might get the sense from youth that, you know, they really would prefer to have volunteer hour credits for school through the work that they do with the advisory committee. And of course, the way that you would figure out what reciprocity means is through recognition. And when we say recognition, we mean recognition of where someone's at and where a community's at, and recognizing the work as well for us, which has been really important, recognizing the work that's already been done. So not coming in as total strangers as Foundry Central Office and saying, this is what you guys need to do, but looking at, you know, what have you done so far, and what have you built so far, and really wanting to support the work that's already being done. And the final piece is relationships. And this piece, we really feel that this is how everything starts. The relationship acts almost as a container for the work that's being done, because if you have a solid relationship with someone, even if you know you have a youth engagement event or an advisory committee and things don't go well, you can still keep that connection going. You can do better next time. You can get feedback. And next slide, please. So specifically speaking to relationships, I put in a quote there from John Gardner because I felt like it really resonated with me when I read it. Many of our young people today wonder whether they have any place in this vast and complicated society of ours. They feel anonymous and rootless and alienated. They are oppressed by the impersonality of our institutions. In my judgment, there isn't any quicker cure for that ailment than evidence that their society needs them. And that really resonated for me because for me, I was that young person. I was somebody who felt like I didn't have any place, and like I was just kind of being pulled along in this system that didn't care about me, and I was just a number. And that's why I think the relationships piece is so important to the work that we do, because if you nurture that relationship, regardless of what might happen, regardless of if services aren't working for someone, you can still improve on things, you can still support each other. And so the things that we see composing relationships are time, connection, and opportunities. So time is a resource that you can't get back, and I think it's one of the most important things that you can provide in a relationship. So not just being like, okay, we have 1 hour for this focus group, we're going to bang through it, and then when we're done, we're leaving. But recognizing, sometimes things take a bit longer, showing up early, sitting down with people, getting to know them, and not just being super outcome oriented, really taking your time with the process and taking that time to build the connection. And so the connection comes from investing that time and understanding who the people are that you're working with. And finally, opportunities. And this is something that I think is really important because if you are connecting with someone and you understand who they are and what they want to do, you can recognize where there might be further opportunities for them to be engaged. So like with a young person who you're working with, if you recognize, hey, like they're really interested in research, they're part of this advisory committee, but they mentioned they really want to do research one day, but they don't know how to get into it, providing opportunities for them to network with researchers or connecting them to a researcher who might be interested in looking for an assistant, or even recognizing, that there might be an opportunity down the road for them to be involved with the research that we are doing at the central level. Next slide, please. And so peer support. The reason that peer support and youth engagement, I think, can sometimes get confused. We've noticed sometimes that they get confused and that people might think that they're doing youth engagement when they're doing peer support, or think they're doing peer support when they're doing youth engagement, is because they both involve the empowerment of young people to be involved in creating a community that is better able to take care of the people that are in it. And so just giving a really brief history of peer support at Foundry. That is a picture there of Sarah Irving, and she would actually kill me if she knew that this picture was up here. But she wrote the peer support curriculum that we are currently wanting to roll out at Foundry. And she wrote it because she felt like there wasn't a curriculum that was available that was for youth, by youth, and created with youth. And so she did a lot of community consultation and a lot of consultation with peer support workers and people who'd access peer support. And from that, this curriculum was created. And the idea is that now peer support workers can be trained and almost formalized in their role. Because we want peer support workers to be seen as assets in the same way that clinicians are seen as assets. And so with each Foundry Center, there are 5 core services that are provided, and that includes primary care, mental health services, substance use services, social services, and peer support. And the idea is for all of these services to be integrated and to communicate with each other. And so we feel that by providing that training through the curriculum, it'll be easier for clinicians to receive and understand the role of peer support, and peer support workers will feel more prepared going into it. And so when it comes to peer support and youth engagement, the way that they differ is that peer support for us is it's a core service that's offered at Foundry Centers, but youth engagement is an underlying process that underlies everything that we do from start to finish. But then there are ways that peer support and youth engagement overlap as well. So what we've seen with the centers is that there has been a lot of youth engagement of peer support workers. So peer support workers being engaged to bring themselves more into the work that they do. So a great example of this is with a peer support worker at one of our centers. They're really into growing food. And so they started a garden at their center. And that was kind of a way that they wanted to enhance the wellness of their peers. And also with peer support workers can act as avenues for youth to enter youth engagement. So a peer support worker might be connecting with a youth and realizing, hey, this person really wants to feel like they have more of a voice in the system and like they're better able to inform services, and then connecting that young person to opportunities for them to be engaged. And also supporting them through that and supporting them to see the power and the perspective and the wisdom that they have. As well, peer support workers at some centers have been supporting local youth engagement. So they have been present at some advisory committee meetings, at focus groups, and things like that, just to kind of be someone where youth can feel like they can informally check in with them, and they know that there's somebody in there who gets them and who has their back for those kinds of meetings. And finally, with peer support, something, as I mentioned earlier, it's really important to me because I see it as an avenue to personal and professional development, because for me, peer support was how I got involved in this field. I wouldn't have had a career without peer support, and I wouldn't have had as meaningful a career without peer support. And I think, within all of the work that I've done, I've seen the transformative power that peer support can have when it comes to youth seeing themselves as part of their community's wellness, as part of the solution, and not just as people that are having services done to them. And that is it for my slides. I'm not sure what time we're at, but hopefully that was under 20 minutes.
Thanks, Andrea. We're now in the Q&A segment, so please write your questions into the question field, and we will have them asked to Carrie, Jess, or Andrea. To get us started, here in the room with me, I have Kendra Milne. She is our Senior Director of Policy, Planning, and Government Relations, and she's going to start us off by asking a few questions.
Thanks so much, Amelia. My first question is for, I think, both sets of speakers. And I was wondering if you could comment at all on strategies you've used or how you approach engaging youth, particularly in rural and remote areas, when you're looking at engaging folks in terms of service development and service design. Maybe start with Australia.
Yeah, sure. It's a great question, actually, because I think we're very similar to yourselves in that there is an untapped population that it can be quite hard to engage with services. We've actually been doing a lot of work recently around how we can better provide services to young people in remote and rural areas. And as a result of that, we recognise that we need to apply all our design and delivery concepts to those young people as well. So we're actually very proactive at making sure that when we're going out and doing research and trying to understand the needs and the preferences, which I think Andrea flagged and is very important. It's not just about what young people need, but also what it is that they prefer and how they're going to engage with services, so that we can design them in the way that's going to best intersect with the way they live their lives. So we actually go out, we send teams of people out to remote and rural areas to undertake some of that research. And equally, when we're running some of our programs, like our moderator programs, and we're bringing young people from across the country, we fly them into Sydney so that they can access the training that we offer. So we do make sure that we're not kind of just focusing on metropolitan areas, but we're very proactive at making sure that if we either go out to them or we make sure that we can provide access so that they can come to us to help with the work that we're trying to do with them. And so I guess the final comment I would make on that is for youth involvement or youth engagement to work well, you really need to invest in it. It's not something that is just going to happen passively. You really do need to make sure that you see it as a priority and you do invest in it in the way that is needed.
Yeah, I think I might just add one thing to that too. I think a really important component of our service delivery has been partnering with organisations that help link us with the young people in their communities, and that's been a really helpful step for us in engaging young people, particularly of diverse communities such as rural and regional young people.
Right. So with us, we have a few of our centers are in more remote locations. So part of that has been really ensuring that we can head out there and we can create those relationships and connections so that we can support the youth engagement that they want to do at a local level. But also I'm just going to turn it over to Rebecca just so she can tell you guys a bit more about that.
Yeah, it's a really good question, and I think speaking to I think, you know, Kerry, you mentioned quite articulately we face similar issues in terms of the distribution. As an Australian now in Canada, I can kind of see that more fully, although the temperature difference is marked. But I think that one of the things that certainly Foundry is trying to do, and appreciating too that as Andrea mentioned, Foundry is only kind of 2.5, 3 years into its journey. So our focus has been trying to build out these centres, these 11 centres, as essentially kind of hubs, and then from there kind of expanding and delivering services that have greater outreach into the communities, and particularly around youth and their families, in a way that they perhaps wouldn't connect with a centre, and thinking through some of those. So we're in really, you know, the early stages of development in some aspects of that, and that includes some aspects of our virtual care work. We're working really closely with BC Children's Hospital around that. They've been building out Foundry Online as a website in the short term in terms of some of the resources and supports that are available, and have been doing really a spectacular job in that, and we've seen a huge amount of engagement across the province in using the tools and resources available there to support young people who might need some supports or some direction to services, whether they be online or in their communities, and connecting up with centres. The other piece we're looking at developing too are virtual mobile clinics. And they would come out from the services to also kind of from a service perspective, but also would have peer support as a kind of core element of those things with in communities. So that's really in its early stages of development here. We've got one site at the moment that's looking at developing that, and we would hope to expand that over time. And the other piece really is around a virtual care platform that really leverages the partnership that we have with BC Children's Hospital here in British Columbia, who has been developing Foundry Online and working closely with them, and also the province, the Ministry of Mental Health and Addictions, and the Ministry of Health, in addition to TELUS, to really build out a virtual care platform to really support young people as a part, again, of providing both youth engagement opportunities through that, but also peer support opportunities through that. Again, that's very early in its development. We're in the first phase of that work at this point in time, but hoping that will kind of get to a place where we're able to provide talk, text and chat functions across the province. So that's some of the things in terms of reaching out to regional and remote communities in British Columbia. And I think Steph can also speak a little bit to some of the outreach services that are also offered from a centre level that might also help to populate or respond to this question.
Hi. So exists really, that's really depends on the partnerships that are at the local level. So there's definitely the services that are offered at the center, and then depending on the needs of the community, then there's peer support workers that would do outreach with or without staff to support them. I mean, I think in terms of engaging youth and responding to the needs of youth and communities, there's an interesting example in Campbell River where they identified and they noticed how some youth weren't accessing services anymore during the summer months, and then they realized that it was because the school bus that would bring youth to the community doesn't run in the summer months. So interesting how that came up, and what they responded in a way and involved youth in making that decision to mobilize a team that would then provide in-reach into that community. So that was one way to really help meet the needs of a rural community that didn't have that direct access. So it really depends on the local community to come up with a response. And so far, lots of innovative thinking out there, and try and do the best we can to those folks in rural areas.
Thanks so much. Our next question is from an audience member, and it's for Carrie and Jess. They asked, how do you support the well-being of the peer moderators themselves? Are all your peer supporters paid or volunteer-based?
Yep, so I can answer that one. So my job primarily is actually working with our moderators to support them to be able to provide peer support. So we do a number of different activities throughout the year to maintain their well-being and ensure that they can continue to thrive in the role. So we have a yearly training where we actually fly all of our moderators to Sydney, and we do a number of team building workshops. We look at things like self-care. We do a whole range of different activities around peer support and engagement. We also do monthly check-ins, so we have debriefing sessions with our young people and with our parents, and we have daily contact with our moderators. So we have an online community specifically for our moderators to be able to learn and chat with each other, and it gives us an opportunity to be able to address issues as they come up straight away. So between myself and the other online community coordinator, the majority of our time is spent supporting our moderators and helping them build their confidence and skills.
And I think so there was also the question about, is it a volunteer or a paid role? At this stage, it's a volunteer role. The commitment that we ask of young people is for 2 hours a week of their time. Some people do more than that. It's really up to them. We are looking, as our peer support community is growing, we are looking at opportunities to expand that and look at sort of different ways that we can use technology to deliver peer support. And as a part of that, we are sort of looking at how we can more formalise those roles and look at paid opportunities and incentivise the volunteering as well. The feedback that we do get from the young people, and it's something that's very important to us in the way that we design the program, is that sense of mutual benefit. So, I mean, we could not run the program without them, but we also make sure that we work with them to build the skills, and so they get a lot out of the program as well. And the other thing that I think that we're very mindful of is, you know, young people with lived experience having conversations. Sometimes, you know, it can be you know, quite a difficult environment to be a part of in a long-term basis. So we do make sure that the moderators feel really comfortable to know when they can take a break. And if they do need to have days, weeks, even months away from the forums, we do make sure that we work with them around kind of boundaries and self-care and how they're feeling. So they feel really confident to let us know when they need to have a break from that role as well.
Great, thank you. Our next question is for Andrea at Foundry. How do you approach interdisciplinary work, and are there any challenges to having many different service providers under one roof?
That's a super easy question. No, that is a really good question, because I think we've noticed that it's unique for every community, because every community has unique partnerships that compose the Foundry Center. I think what we've noticed is that with the integration piece, it takes time. It really takes time for people to start getting comfortable with the idea of you know, working in a more integrated way. But just having everyone under the same roof is a huge piece of that. And I think you know, we really prioritize the idea of the warm handoff when it comes to services. So if somebody comes in and, you know, they're seeing their counselor and they mention, you know, they are looking for birth control, a warm handoff to the sexual health nurse and mentioning, you know, this is her name and I know her and I trust her. And I think what's been really helpful with the integrated piece is somebody might come in for one thing and realize that they need another, and that other that they need is something that they might never have themselves said, you know, I need this service. So for example, if somebody comes in for primary care and, you know, they mention to their doctor that their mood has been incredibly low for the past few weeks, or, you know, they really feel like something's off, then that doctor can provide that warm handoff to a counselor, and that person can access mental health services, whereas before they might, the stigma might have stopped them, or, you know, they might have never really been comfortable saying like, yeah, I think I'm depressed and I think I need support. I think the challenges are unique to the local community, so it's tough for me to say exactly what it's been like for each center. But I have noticed from quite a few of the peer support workers that I've spoken with that they are, in terms of having all those different services around them, they are learning so much, and they are creating so many connections, and there's so many opportunities to better understand how those services can support someone's wellness. So speaking from the peer support lens, I think that's what we've seen. Rebecca or Steph, do either of you want to speak to that? Steph from the GYC perspective.
Sure, happy to. Yeah. I mean, I think in terms of integration, integrating peer support workers on the team, that's been a it's a long road for sure. I was a part of bringing peer support workers onto an intensive case management team a few years ago, and really it's a shift in practice. It changes the way how services are delivered. It gets people to challenge their scope. And to trust other people in other disciplines. So I completely agree with Andrea's point about it starts with relationships and trust. We've done a lot of development work really about dispelling myths. So what peer support workers are, what they aren't, and really making sure that there's an infrastructure to support peers in their work. So making sure that there's someone that supervisor, someone they know that they can go to for support. There's an adult ally as well. So that's an advocate, that someone on the team that is their advocate. That's not necessarily their supervisor. And so that's really ongoing work. We've been developing some standards. So really, what are the expectations for peer support workers themselves, and what are their expectations for the director level and for the organization? So that's been some work that we've done. We're also looking at developing a community practice so that there's a formalized network for peers themselves. So that's some of the work that we've been doing. So hopefully that answers the question. I'm going to turn the camera to one of these two.
Yeah, so I'm not sure that answered the question, because I think the question was generally in terms of integrated care in general, but I think, as Rebecca mentioned, we are still quite young, right? Mm-hmm. And I think it'll be a process, but I think it is, from what I've heard from the young people accessing services, it is incredibly relieving to not have to go to like 3 different buildings for the services that you need, and it's also pretty relieving to not have to meet like complete strangers every time you need a different service.
Great, thank you so much. We're coming to the end now of our question period. I'm just gonna throw out one last one to Jess and Carrie. An attendee asked if you could comment on the relationship between formal peer support workers and other clinical staff, and if you have an articulated triage process for when people access Reachout.
Yeah, sure. So to answer the first question, we don't necessarily provide clinical-based services. We are predominantly a peer support service, and we work in partnership with other organisations to help young people get to clinical support, but that does happen off our site. Did you want to answer the second?
Yep. Sorry, Millie, can you just repeat the second part of that question?
When people access your services, is there a triage process if they're in greater need?
So we have, there's a range of different ways that we can do that. As Jess said, because we don't offer a clinical service, most of the work that we do and the information and resources that young people have access to, including the peer support community, is self-navigated. So young people it's a very, very self-directed in terms of the journey, and young people actually gave us a lot of feedback that was what they were looking for. They wanted to be able to sort of dip in and out of resources depending on what they needed. We do have on every page, on every resource that we have an urgent help page, so that young people can, if they are in high distress, they can jump on there and they can find the information very quickly about the services that they can access to support them. And then within our peer support community, That's really done by the staff that are in there moderating, who are supporting the peer moderators. So we're quite clear about the boundaries of the peer moderator role. So they're really in there being, I guess, we refer to it as the eyes and ears of the community, and so they're role modelling the behaviours that we want to see and how we bring our community guidelines to life to keep everybody safe. But as soon as if there's any posts or young people having conversations that kind of step outside of that and are exhibiting high distress, then that would get escalated to the staff moderators, who would then do a help-seeking intervention with the young person who's articulating that distress, and then help them to access services. Ideally, we really want to try and empower the young person to do that on their own, but we do have, if we need to use them, protocols even up to emergency services, so that we can call on emergency services if we do need to get support to a young person right away. And we work in partnership with a whole range of mental health organisations as well, in terms of it's probably not quite a warm handover, wouldn't be quite the right word, but because we know services quite well, we can give a very kind of, I suppose, gentle introduction to people about what they can expect when they engage with another service. And we primarily partner with, in terms of referral pathways, other digital services in Australia, because when young people who come to Reachout start their mental health experience online, often they're very happy to then kind of, or their preference is to then continue that online as well. So we have a range of digital services in Australia that offer that kind of counselling or therapeutic support to young people in an online environment, and we would help the young person to access those services.
Great, thank you. So that brings us to the end of our question and answer. Really quickly, before everybody signs off, I first of all want to thank our presenters and everybody who joined the webinar. A quick mention before you go, you'll find a short survey in a pop-up window when the webinar concludes. We greatly appreciate if you take a minute or two to fill out the survey. Your feedback will help us design future policy webinars that address topics that are of interest to you. So that's all from us. Thanks everyone. Enjoy the rest of your day.
Thank you.
Thank you.